Alrighty guys, a very warm welcome to another video. Today we're going to be talking about vitamin D and why it is so important for endurance athletes, but really anyone who has a focus on health or really cares about their health in general. So vitamin D deficiency is so common, and we'll get into that in this article, which is the role of vitamin D in athletes and their performance, current concepts, and new trends, which is a great review article from 2020, and we'll read through it all, but it may be a little bit lengthy, so I'll try and break it into timestamps. But if you don't have time, the main gist of the whole video is going to be that vitamin D is so important for many functions which affect athletic performance, and it is one of the most common deficiencies that we see in the general population, but also in athletes, regardless of your level of sun exposure. Because remember, we're covering up, we've got sunscreens, and all of these can affect the vitamin D synthesis and also the level of melanin in your skin, how dark your skin is, where you live in the world can always affect it. So, and your diet in particular as well. So vitamin D is important for, or has roles in, bone turnover and the role of improving bone density and bone mineralization. So therefore fracture risk reduction. It's important for muscular function and contraction of muscles, important for the cardiovascular system and the heart. And we know that's more important now more than ever, particularly with athletes. It's important for the immune system. All of the immune cells in the body basically have vitamin D receptors. So autoimmune conditions, it's important for lung function. Asthma is heavily associated with vitamin D deficiency. And in some cases of exercise-induced asthma, we've seen athletes that have really resolved that with correcting vitamin D deficiency or improving their stores of vitamin D. So that's just a few things of a bigger list of things that vitamin D is really important for. So we'll get into the article now, read through it, dissect it as we go, and you can really learn how you can optimize. Well, one, check your vitamin D status, what you should be aiming for with vitamin D. Obviously, as a disclaimer, none of this is medical advice, so always work with a qualified healthcare practitioner, treating physician or doctor that's overseeing your health, and therefore, go based on their recommendations. But where you should be aiming in terms of optimizing your vitamin D and why it's important for athletic performance. Ironman, triathlon in particular, when you guys are training so much, you're doing all the work, and if you're not getting the return the return on investment that you feel like you should be deserving, vitamin D deficiency could be a culprit. So let's get into it. So this is from Nutrients. This is 2020, a nice overview article here. So or review. So role of vitamin D in athletes and their performance, current concepts and new trends. So we'll read through the abstract and then dissect it a little bit deeper. We're currently experiencing a vitamin D deficiency pandemic across the world. Athletes have the same predisposition to low levels of vitamin D, the majority of its concentrations being below 20 nanograms per milliliter in a wide range of sports, especially in the winter months. Vitamin D is important for bone health, but recent research also points to its essential role in extraskeletal functions, including skeletal muscle growth, immune, cardiopulmonary functions, and inflammatory modulation, which influence athletic performance. Vitamin D can also interact with skeletal tissue to modulate injury recovery and also influence the risk of infections. The data presented in this paper triggered investigations in relation to the importance of maintaining adequate levels of vitamin D and to the possible positive influence supplementation has on immune and musculoskeletal functions in athletes, benefiting their performance and preventing future injuries. The objective of this review is to describe the latest research conducted on the epidemiology of vitamin D deficiency and its effects on sport performance and muscular health. So we'll skim through it a little bit, just kind of take out the main chunks of information that's relevant for us as athletes, and what we should be looking to, or what's actually useful and kind of relevant from a more real world aspect or clinical aspect. So introduction. Over the past decade, interest in research in relation to vitamin D has been growing exponentially, partly due to increased prevalence of its deficiency in the population and the association between deficiency of vitamin D and a wide range of diseases. The importance and versatility of vitamin D in the organism is becoming increasingly evident. Vitamin D plays an active role in immune function, protein synthesis, muscle function, cardiovascular function, inflammatory response, cell growth, and musculoskeletal regulation. In relation to vitamin D and its role in athletes, an important field of research on its influence on bone balance, muscle resistance, and athletic performance is currently underway. So it goes into why athletes are particularly at risk of vitamin D deficiency. Different locations, different sports. Some are played indoors. Some are, some people use more sunscreens. It's also dependent on, like we said earlier, your actual skin tone, etc. And obviously a bit more of a description about why it's important for reducing injuries, etc. So synthesis and metabolism of vitamin D, we don't necessarily need to unpack this a whole lot because this is the real science of it all. But essentially, we talk about vitamin D synthesis in terms of the sun or UV radiation, which is UVB, which is hitting the skin, and it's exposed to this 7-dehydrocholesterol, which is stored inside the actual plasma membrane of every skin cell. Again, we're getting a little bit too scientific here, but the main gist of it is that we have sunlight exposure to the skin that needs to undergo various processes before it actually gets to vitamin D3, which is the active form of vitamin D in the body. And that involves the kidneys, that involves the liver. And so it's not just merely a case of sun exposure on the skin. There's a whole bunch of processes that result. But unless you have some very rare deficiencies along that line of metabolism, it's unlikely that you're not going to improve your vitamin D by getting sun exposure. But nonetheless, this is the whole kind of cascade of, or a very brief overview of a cascade of events, and then some of the things it can affect as well. So bone, immune system, pregnancy, even reducing preeclampsia risk, which is high blood pressure in pregnancy. Role in the pancreas, reduced risk of type 2 diabetes mellitus, even insulin secretion improved, and reduction in insulin resistance, and then obviously effects in children too. So vitamin D mechanism of action, again, this talks of how vitamin D, when it decreases below normal limits, we have an increase of parathyroid hormone, which increases the metabolism of calcium from the bone into the blood to maintain blood calcium levels, increases the risk of stress fractures, not something we want. And then, the whole bunch of other mechanisms that vitamin D acts by, not so clinically relevant for athletes and the actual implications of it. So we'll skip through. Dietary deficiency and insufficiency, quite difficult to achieve adequate vitamin D merely through diet alone. That's often why supplementation is, quite preferred in the sense of when we have a vitamin D deficiency diagnosed. This talks about how we measure 25 hydroxy vitamin D. This is the blood test to determine status of vitamin D. So make sure you're getting this 25 OH vitamin D blood test if you are getting a blood test for vitamin D in order to have an accurate representation of your vitamin D storage. And then we have levels, and this kind of goes again into this a little bit more, which is important to note. But we'll touch on it now because, this is a lot of information here, but we'll read through and unpack it. There are studies which suggest that the value of vitamin or 25 OH D greater than 30 nanograms per milliliter, and this will be different in nanomoles per liter, so be careful there with your units, should be considered as acceptable for maintaining bone health and reducing the risk of fracture in healthy young people and adults, while others suggest that necessary levels should be set at greater than 40 nanograms per milliliter. On a more conservative basis, the US Institute of Medicine states that concentrations of equal to or greater than 20 nanomoles per liter, nanograms per milliliter, which is 50 nanomoles per liter, should meet the needs of 97.5% of the population. So here we go. In Australia, I know this is really the threshold or the cutoff. Anything below this is considered at risk for deficiency or insufficient. So 50 nanomoles per liter. That's obviously the general consensus, and what's kind of emerging in the science is that the level is likely a lot higher than that, in the realm of 75 to 100 nanomoles per liter at the lower end, upwards of 125 up to 150 nanomoles per liter. Again, not wanting to go too far above 150 into the 200s even, because then you're risking toxicity. So that's important to note, is that even if you get vitamin D blood test and your level comes back at 51, most general physicians will say, yeah, absolutely fine. But if, for example, that's at the end of summer and you're going into winter, you're likely going to be extremely insufficient, and you're likely not even optimized anyway, because you'd rather be 75 to 100 at a lower end of your vitamin D nanomoles per liter. So, role of vitamin D and its relationship with the condition of the athlete. So again, this touches on how, bone balance and how that's really been important or focused on, but then fracture risk and skeletal muscle. And actually, we will read through this because this is where it's kind of quite important to understand. So traditionally, it's been assumed that the main function of vitamin D was the maintenance of calcium homeostasis and serum phosphate. On an adequate amount of vitamin D and calcium is required for the development, growth, and integrity of bones. Currently, vitamin D has been shown to influence bone health by activating expression of genes that improve intestinal absorption and renal absorption of calcium in association with an increase in parathyroid hormone and bone turnover. Vitamin D also contributes to the mobilization of calcium of the bone by means of osteoclastogenesis. Again, these are cells which work on osteoclasts, work on breaking bone down, that results from the activation of several genes. We don't need to go into that too far. On the other hand, vitamin D is closely related to parathyroid hormone. Again, deficiency will increase that. We've kind of talked about that before. And therefore, essentially the main gist of this is that sufficient or optimized levels of vitamin D are important for healthy bone mineralization and healthy bone mineral density, which is even more important for aging athletes, but particularly endurance athletes, and particularly in sports like triathlon where you do running. Obviously, swimming and biking aren't going to put a lot of stress on the bones in terms of impact. But running in particular is a high risk for stress fractures. So very important. And then the effect of vitamin D on fractures. So a particular relevant section refers to the action of vitamin D in stress fractures, which are frequently observed in athletes, which represent from 0.7 to 20% of all clinical injuries in sports medicine. And again, big range, but across different sports, it's going to vary. Although it has already been stated that vitamin D levels can affect bone mineral density, there is less knowledge of the role of vitamin D on fracture healing, and there is no scientific evidence of it. So it's a kind of explored field. A review found that vitamin D reduces, increases, or has no effect on soft callus formation phase during fracture healing process. Other studies find conflicting results regarding the effects of vitamin D on callus mineralization phase. However, a recent investigation found lower serum levels of vitamin D in patients with delayed fracture consolidation, while other studies found no differences between patients with diaphyseal fractures and those who presented delayed healing. So whilst what this is saying is that there's no effect really in terms of vitamin D, or it's unestablished the effect of vitamin D on fracture healing, it's not mentioning the actual effect on vitamin D in fracture prevention, which we know that bone mineral density plays a very large role in that. And therefore, we're improving bone mineral density by having optimized vitamin D levels relative to being insufficient or non-optimized or even deficient. And therefore, by product of improving bone mineral density, we're going to be, to some capacity, reducing the risk of fractures. But it is a more complex thing than just saying we will, safeguard ourselves from fractures. A lot comes into that. We then have the role of vitamin D in skeletal muscle. So vitamin D has been shown to be a powerful modulator in skeletal muscle physiology. Vitamin D influences it by activating the expression of genes that influence muscle growth and differentiation, particularly in fast twitch fibers type 2. In addition, enlarged interfibrillar spaces and infibrillation of fat, fibrosis and glycogen and muscular dystrophies are shown in muscle biopsies of individuals with vitamin D deficiency. Biopsies of 12 patients with vitamin D deficiency before and after treatment with the vitamin found atrophy of type 2 muscle fibers before treatment and significant improvement after. So again, long story short, vitamin D very important for muscular health and not to be overlooked. Effects of vitamin D on lung function. Vitamin D insufficiency has been associated with impaired lung function, asthma, and chronic obstructive pulmonary disease, or COPD. On the other hand, vitamin D deficiency resulted in deficits in lung volume and correlated with multiple indices of compromised lung function and increased airway reactivity. These actions of vitamin D favor alveolar structure integrity, which is the finest or the small structures in the end at the bottom of the lungs, really. Pulmonary compliance, vital capacity, and oxygen exchange. So these are indices of lung function. But long story short is that, vitamin D is very important for lung function, and reducing inflammation, reducing reactivity, avoiding things, or minimizing the risk of things like reactive asthma, etc. So therefore, it's not to be overlooked, particularly if you are someone who suffers from asthma or anything like that. Vitamin D and cardiovascular function. So this talks on heart health and how being vitamin D deficient may have effects on increasing the risk of like left ventricular hypertrophy, which comes back into parathyroid hormone. But again, it's a little bit more of a, or prediction or hypothesis, more so than absolutely proven. But very important for heart health in general. It's also important in cardiovascular function. So the health of the blood vessels, the endothelial function, and generally, reducing atherosclerosis, which can lead to, blockages in the arteries, etc. So generally very important for heart health and cardiovascular function overall. And whilst it may not seem completely related to everyone, from everyone's perspective, vitamin D deficiency has actually been shown to be implicated in erectile dysfunction. And in cases where there's really no other known pathology, correcting that can improve erectile function. And we know that why that's kind of relevant to cardiovascular function is because erectile function is kind of directly, among other things, testosterone hormones, etc. It's kind of, and brain chemistry, it is related to cardiovascular function because it is a direct response of the actual arteries and arterial dilation, nitric oxide production in that cardiovascular system, which allows for that erection to take place. So that's an important, or not an important, but a side note there. And then immune system, again, super important for preventing autoimmune conditions, preventing against colds, influenzas, viruses, etc. Important for, really, modulating the immune system in terms of ensuring it's doing what it's supposed to and not reacting to your own cells or causing other issues that are those autoimmune conditions. And the nervous system even. So vitamin D affects the central and peripheral nervous system. Vitamin D receptors are present throughout the brain, including primary motor cortex, which is the region that coordinates movement. We also know that vitamin D affects neuronal function, maturation, and growth, and exerts direct neuroprotective effects through synthesis of proteins that play a vital role in neural activity, including transmission. So super important for the nervous system, brain health, cognitive function, coordination of muscle movements, or movement, like sensation to movement coordination, and all of those things that are involved in the whole nervous system in general. And also, if you think about its effect on then, therefore, neurotransmitters, etc., mood, drive, motivation are all going to suffer in terms of vitamin D deficiency. So super important and not something to be overlooked. So then we kind of get into the main thing, which is vitamin D supplementation in athletes and how this can, be beneficial. So despite the special attention given to diet in athletes, we must bear in mind that some micronutrient deficiencies may appear. It is generally believed that if an athlete follows a balanced diet, they will not require supplements. However, this idea may be too simplistic. First, determining dietary fitness in athletes can be challenging. So, of course, vitamin D is very difficult to improve merely through diet alone. And often, the main source of vitamin D is the sun. So that's where we get most of it from. But obviously, we can improve it somewhat through diet. However, I wouldn't be using diet alone as a means of improving vitamin D deficiency. But maybe if you are already sufficient and want to otherwise optimize it, you could possibly do it through diet. However, and with sun exposure, of course, you never want to be in the sun enough to get burnt, but just very short intervals of sun exposure on the skin can enable, I think it's something in the realm of like 10 to 15 minutes of total body sun exposure or skin exposure, depending on where the sun is, various times. This is going to be a very broad and inaccurate statement in the sense of there's nuance to it. But it's like, 10 to 15 minutes of sun exposure is like 10,000 to 20 international units of vitamin D per day. And if you think about one vitamin D tablet in a supplement, it's usually like 1,000 IUs or international units. You can get 5 or 10,000 ones, but not really here in Australia over the counter. And so therefore, we get into supplementation with the appropriate dose of vitamin D. So it seems that vitamin D supplementation in the general population is important for preventing and avoiding its deficiency. However, there's a lot of controversy regarding the appropriate supplement doses. And then in athletes, it's even more controversial. So several vitamin D guidelines and guidance papers have been published with heterogeneous and partially opposed opinions and recommendations regarding vitamin D requirements. So, we get into the where are some recommendations. Yeah, so the RDA, or the recommended dietary allowance, generally is the IOM, not exactly sure what this is referring to, or Canada here, is adults under 70 years of age, 800 units or international units. 600 for adults under 70 and 800 for adults over 70. US recommendation is higher. And, here we have the Endocrine Society raised this from 600 to 800 all the way up to 1,500 to 2,000. And then randomized control clinical trials of 70 athlete subjects was randomly divided into two groups. They found that weekly uptake of 50,000 international units of vitamin D improved only certain athlete performance tests. They concluded the optimum dosages for athletes needs further studies. But nonetheless, you don't want to be over supplementing because you can risk toxicity, of course. However, excuse me, unless you really are pushing the dosages up and you've already got optimized levels, which is why you really need the blood test to confirm your baseline levels, it is going to be, it's certainly, and here's a good point, if little is good, more is better is a dangerous misconception because, of course, like with anything, you don't want to be going into toxicity levels. However, generally, through supplements from a store, 1,000 international units or even 5,000 per day, studies have shown that that's been safe for like years on end. And I'm not going to say that safe for everyone. And this is why you really need to go and consult your own physician for what's going to be good for your health and what you need to be doing. So I guess the conclusions is going to kind of summarize this all together. But I think we should wrap it up there because obviously it's been a long video. And if anyone's still with me, congratulations for sitting through it. But nonetheless, the main summary or the main takeaway is vitamin D is so common in the population. And that obviously then applies to athletes as well. It can have detrimental impacts if deficient or insufficient on athletic performance and endurance, muscle recovery. So we have like muscle recovery, we have bone health, risk fracture or stress fracture risk. We have immune system being compromised, increased risk of infection, increased risk of autoimmune conditions. We have compromised lung function potentially, inflammatory reactions, asthma, etc., among other things. So cardiovascular function, heart health, brain health, of course, all things we need to be not compromised on. So therefore, the main takeaway is get a blood test for vitamin D if you have access to it. See where you are, work with a physician to get that optimized, and do never risk becoming vitamin D deficient if your priority is performance, if your priority is maximizing your athletic potential, because being vitamin D insufficient or even deficient, of course, well, I should say deficient or even insufficient or not optimal, can certainly detriment your athletic performance and is something you want to avoid if you are an endurance athlete. So thanks for hanging around for the full 25 minutes. Take care, everyone. Leave any comments, questions below. Sorry if that was a drawn out talk. Again, the main takeaways are important. Check your levels, fix it if you need to, because you'll otherwise be compromising on performance and recovery and race outcomes. So take care, guys. See you in the next video. And Happy New Year to everyone as well.